The kidneys are two fist-sized organs located in the back of the abdomen on either side of the spine. They serve a vital role filtering waste, toxins, and excess fluid from the bloodstream. The kidneys balance electrolytes, produce urine, regulate blood pressure, and maintain the body's internal equilibrium. When the kidneys become damaged, these functions do not work properly, leading to a condition called chronic kidney disease, CKD. CKD causes wastes to build up in the blood, often producing symptoms like weakness, shortness of breath, nausea, itching, and loss of appetite. As the kidneys fail, dangerous levels of fluids and electrolytes can accumulate. CKD has various causes, including high blood pressure, diabetes, inflammation, and inherited diseases. But regardless of the initiating factor, CKD progressively damages nephrons, the tiny filtering units inside the kidneys. This reduces their ability to properly cleanse the blood. Over time, CKD can advance to end-stage renal disease, where the kidneys cannot function at all. At this point, dialysis or a kidney transplant are required to sustain life. Both options have significant disadvantages that impact independence and quality of life. Dialysis requires being hooked up to a machine for hours, multiple days per week. Transplants involve major surgery and lifelong immunosuppressant medications. Since kidney damage cannot be reversed, the best outcome is preserving remaining kidney function as long as possible. This involves controlling underlying conditions, taking medications as directed, and making kidney-friendly lifestyle changes. Adjusting one's diet is particularly important, as what we eat influences kidney health in multiple ways. While some foods help protect the kidneys, others can tax them further and accelerate damage. People with kidney disease need to limit intake of sodium, phosphorus, and potassium, which build up when kidneys are not working at full capacity. They also need to avoid foods that irritate the kidneys, increase metabolic waste, spike blood pressure, or worsen kidney inflammation. Unfortunately, many vegetables considered universally healthy top the list of foods to restrict for people with compromised kidney function. While packed with beneficial nutrients, they either contain high amounts of potassium, phosphorus, or oxalates that place extra strain on impaired kidneys. Let's now explore 10 vegetables those with CKD or end-stage renal disease should limit or avoid completely. Number 1. Potatoes. Potatoes are high in potassium, containing over 400 milligrams in just one medium-baked potato with skin. Healthy kidneys can easily handle this amount, but those with CKD cannot efficiently excrete excess potassium, allowing blood levels to rise. Elevated potassium can cause abnormal heart rhythms and muscle weakness. People in advanced stages of CKD must restrict high-potassium vegetables like potatoes. Number 2. Tomatoes. Tomatoes are another high-potassium vegetable, harboring around 300 milligrams per large raw tomato. Tomatoes are also very acidic, with oxalic acid being the predominant acid. Those prone to kidney stones should avoid eating too many tomatoes, as oxalate salts can crystallize in the kidneys and form painful stones. Tomatoes are fine in moderation for early-stage CKD, but may need to be limited in advanced disease. Number 3. Spinach. Spinach is packed with iron, vitamin K, and phytochemicals that make it super healthy. But this leafy green is also high in potassium and oxalates. Just 1 cup of cooked spinach contains over 800 milligrams potassium and almost 700 milligrams oxalate. The combination makes spinach a less than ideal choice for those with impaired kidney function. Limited portions a few times a week may be acceptable depending on lab results. Number 4. Beets. Beets are a powerhouse vegetable loaded with beneficial nutrients like folate and manganese. But beets are also high in both potassium and phosphorus, providing over 500 milligrams of potassium and 80 milligrams phosphorus in just 1 large cooked beet. People with advanced CKD must restrict phosphorus to protect bone health. Beet greens are also high in oxalates. Infrequent small servings may be okay, but beets should be minimized in later-stage kidney disease. Number 5. Sweet potatoes. Sweet potatoes contain even more potassium than white potatoes, harboring 542 milligrams in 1 medium-baked sweet potato with skin. They are also loaded with phosphorus, providing almost 100 milligrams in just half a cup. Furthermore, oxalates levels are relatively high. With all 3 hazards present, Sweet potatoes are generally recommended to avoid in advanced CKD to prevent further kidney stress. Number 6. Mushrooms. Mushrooms provide valuable nutrients like B vitamins and selenium, but they are also relatively high in purines that get metabolized into uric acid. Buildup of uric acid crystals can cause gout and kidney stones. Mushrooms also contain small amounts of oxalates. For those prone to kidney issues, limiting dietary purines from sources like mushrooms helps reduce formation of painful kidney stones. Number 7. Beans. Kidney beans, lima beans, black beans, and other varieties are packed with plant protein and fiber. However, beans are also fairly high in both phosphorus and potassium. 1 cup of cooked kidney beans contains about 240 milligrams potassium and 180 milligrams phosphorus. Furthermore, phytic acid in beans can promote kidney stone formation in those with impaired kidney function. Beans may need to be reduced for advanced CKD patients who cannot excrete excess phosphorus. Number 8. Cauliflower and broccoli. Cauliflower and broccoli are often touted as superfood vegetables, but like other cruciferous vegetables, they contain compounds that break down into oxalates. The oxalates in cauliflower and broccoli can then bind with calcium to form kidney stones and crystal deposits. People with a history of kidney stones should limit intake of these and other high oxalate vegetables. Number 9. Brussels sprouts. Brussels sprouts are highly nutritious, providing vitamin K, folate, potassium, and antioxidants. However, half a cup of cooked Brussels sprouts also contains 384 milligrams potassium and 63 milligrams phosphorus. For advanced CKD patients who need to restrict these minerals, Brussels sprouts may have to be eliminated from the diet. Smaller portions a few times per week may be possible for those with milder kidney impairment. Number 10. Acorn squash. Winter squash like acorn squash make a warming, nutrient-packed side dish, but acorn squash is very high in potassium, delivering almost 900 milligrams per cup of cooked cubed squash. It also provides phosphorus, vitamin C, and cucurbitacins that can promote kidney stone risk. Those with CKD should proceed cautiously with winter squash and monitor labs, as the potassium content is quite substantial. The kidneys have an irreplaceable duty filtering waste and excess minerals from the bloodstream. When the kidneys falter, this function declines, leading to accumulation of toxins and fluid that make us ill. Chronic kidney disease is a progressive condition that can eventually necessitate dialysis or kidney transplantation to stay alive. Since these replacement therapies reduce quality of life in many ways, preserving innate kidney function through nutrition and lifestyle is imperative. However, some seemingly healthy foods can actually tax failing kidneys further and speed their deterioration. Vegetables in particular pose a hazard to those with CKD or kidney damage. While packed with vitamins, antioxidants, and fiber, many common vegetables like potatoes, tomatoes, spinach, mushrooms, and squash contain high amounts of potassium, phosphorus, purines, or oxalates. Those with reduced kidney function cannot process excess levels of these compounds. This allows minerals like potassium to reach dangerous levels in the blood and crystals like oxalate to form painful stones. Therefore, people with compromised kidney function need to moderate, if not avoid, the vegetables highest in potassium, phosphorus, purines, and oxalates. This includes produce like potatoes, spinach, beets, beans, cauliflower, broccoli, tomatoes, mushrooms, and winter squash. Restricting these veggies helps prevent further kidney damage and accumulation of fluids, minerals, and crystal formations. Of course, every CKD patient is different, so work closely with your nephrologist and renal dietitian to determine your ideal vegetable choices. Milder restrictions are needed for those in early-stage kidney disease versus late-stage. The key is being consistent with medical care, medications, and making kidney protective menu choices for your individual health status. While some nutritious vegetables must be limited, many can still be enjoyed in moderation as part of a balanced renal diet. Options like cucumbers, carrots, bell peppers, cabbage, lettuce, and zucchini offer a wealth of nutrients with far less potassium, phosphorus, and oxalates. Herbs and spices also add flavor and phytochemicals. Supporting kidney health requires diligence and sacrifice, but so much vibrant, delicious food remains. Our kidneys keep us healthy in infinite ways, so we must keep them healthy in return. Thank you so much for watching. I hope this video gave you a helpful overview of which vegetables are best to minimize or avoid for kidney health. While all vegetables provide important vitamins, minerals, and antioxidants, some can tax impaired kidneys further and should be limited by those with CKD. If you have chronic kidney disease, please work with your medical team to determine the safest vegetable choices for your individual needs and lab results. Nutrition can significantly impact the progression of kidney disease, so finding the right balance of restricted foods versus those you can still enjoy is key. If you enjoyed this video, please hit the like button and share it with anyone who may benefit from the information. Feel free to leave any comments or questions below as well. I also encourage you to subscribe to my channel for all the latest kidney health videos and natural healing topics. Thanks for watching, and we'll see you in the next video.